Mhm.
Okay. Healthy mind, healthy body, healthy skin. You're listening to Soul Food on Smooth 98.1, where we love music, we love life, we love your health and your wellness. And it's now time to talk about it on Soul Food. Now, every Saturday from 8 till 8:30, what we discuss is your wellness and your health in every aspect of it. If you are new to us, welcome. Thank you so much for being a part of the show. And thank you to those joining on Instagram Live. I see you, Alex. Thank you. We are live on YouTube as well. YouTube is youtube.com/smooth 91 FM Lagos. Again, youtube.com/smooth 91 FM Lagos. And the WhatsApp line that you can use in asking your question is 0809 444 0981. That said, we are talking about keloids this morning, those ugly things. Now, you might not know what they are, or you have seen them around many times, but you don't even know how to describe them or how they come on. Help has come your way because we have a consultant physician and dermatologist, one who advocates passionately for education in terms of your wellness and your skin issues and disorders. And she even has a whole page dedicated to it, as well as content that she drops from time to time, educating on one thing or the other. And she is no stranger to the show at all. We call her the dancing doctor. She is Dr. Folakemi Cole-Adeife, and she's joining me via Zoom. Good morning.
Hi, good morning. Good
Thank you
morning,
for being here.
everyone. Sorry, I'm still in bed, so
It's okay. This is breakfast in bed.
great, awesome.
All right, so let's get right to it because we need to establish the basic definition or at least basic knowledge of what keloids are and how they are different from maybe hypertrophic scars or even razor bumps. What are keloids?
Okay, well, keloids are abnormal scar tissue formation at the site of an injury on the skin. Usually there's an injury or a surgical scar, although in some cases people cannot remember or cannot point to any injury in particular, but it could have been a very small injury that you're not aware of. And when it's healing, it heals with excessive scar tissue formation. Usually, a wound would heal, all wounds heal with scar tissue formation. But once it's properly healed and sealed up, there is like a feedback mechanism on the skin to tell the fibroblasts, that are the cells that produce the fibrous tissue, which is like a glue to glue up an injury. There's a signal that tells the body to stop producing it. But with keloids, it appears that signal is faulty. And so the skin just continues to produce more and more fibrous tissue in the bid to try and heal the skin, which is already healed, by the way, and that results in keloids. Keloids are different from hypertrophic scars because hypertrophic scars do occur in a similar way, excessive scar tissue, but it's limited. But in a keloid, the signal seems to have just been broken, kind of like a tap that, the handle is broken off and the water is just spewing out continuously. So with keloids, the scar tissue even extends beyond, the margins of the initial scar. So when you look at a keloid, you can't even really place where the initial scar was, even if it was like a tiny line, the keloid can will extend further beyond that and has usually has like a claw shaped usually just spreading out, almost like the way cancer cells would spread out, but it's not cancer. It's not cancerous, but it tends to, behave like that sometimes.
Mm, thank you. Now, how is it different, or if it is different at all, from the bumps that men get when they shave or the ones you get under your armpit when you use a shaving stick?
So, while most bumps that people get when they shave are what we call inflamed follicles, inflammation of the follicles. And so usually they are transient. So people can have, some bumps on around the beard area, under the chin, or in the armpit, or in the pubic area if they shave that area. And that response, that's a response to, the friction of the blade and the shaving stick, you know. So that doesn't last long, although sometimes that can result in keloids. So a lot of people develop keloids in those areas because of the injury that comes with shaving. But most shaving bumps are, temporary, and they will be raised for a few weeks, and then they will eventually, disappear because they're more inflammation, not keloids. But keloids occur when fibrosis, occurs, or fibrous tissue, scar tissue is formed in any injury. This can happen also with shaving bumps, but doesn't always happen.
Thank you. Still going further in the understanding of keloids, I noticed that you tend to have them in some areas, maybe your ears, your chest, your shoulders. So is there anything that influences the location of a keloid?
Yes, so some particular body areas have an increased tendency or risk in people who are susceptible to keloids. And this includes the areas you mentioned. One of the reasons for this, there are several factors involved. One of the reasons is these are areas that may be exposed to injury. For instance, the earlobes, because we always pierce our earlobes. So that's one reason why it's a common site for keloid, because piercing is, of course, an injury. It's like, there's a break in the skin. Then areas that have a lot of tension, constant movement, friction, and tension also tend to have an increased risk of, or tendency to have keloids. So that's why the chest is a common location. So if you have an injury on the chest that is constantly undergoing friction from clothing, from movement, and all, and the area has very thick, there's very little subcutaneous or fat tissue around the chest area. So it's usually the skin, very thin fat tissue, and then the bones. So the skin is constantly rubbing against the bones, against the clothing, and that is a trigger for keloid formation. And then the arms and the legs, because they are more exposed to the environment, they are more likely to get little cuts and injuries. And then some areas also have their high tension areas as well.
Mm.
So this is why, these areas tend to be more commonly, the keloids tend to commonly form in these areas. However, a keloid can occur in any part of the body. But yes, there are some areas that they tend to be more common.
So does it mean the only time you can develop a keloid is when there is an injury or a wound? And I ask this because there is a part that there was no injury, at least to the best of my knowledge. There was no injury at all, and this a keloid sprung up from there.
Yes, so that's what I said. So the injury could be microscopic, but a keloid can still form on it. So some people say there's spontaneous keloid formation, meaning no injury at all, like you mentioned. But that's a school of thought. Another school of thought believes that there could be a tiny injury that was so small that you didn't even notice it or take note of it, but there was a break in the epithelium, that's the skin, the superficial skin surface, that maybe you couldn't appreciate or weren't aware of. But it's enough to trigger a response, to develop, to lead to the formation of, or the deposition of this scar tissue, and to lead to the formation of a keloid. So that's typically what happens, And I know there was one video I made talking about micro tears, with sponge using, which people were very
Yeah.
passionate about. We do develop micro tears on our skin that we're not aware of. And a person who has a tendency to have keloids can develop a keloid from a micro tear. And that's why some people say, oh, I didn't have any injury. It just formed. But it could have been a micro tear, from sponging, or just a brush that was not deemed to be an injury, but the body, saw it or recognized it as some kind of injury.
Hmm. If you're tuning in for the first time, you're listening to Soul Food on Smooth 98.1, and we are discussing keloids. My guest is Dr. Folakemi Cole-Adeife, and she's a consultant physician and dermatologist. Now that we have at least a good understanding of keloids, do they stop growing after a while, or they just keep growing and growing and growing?
So for a lot of people, they grow, they have periods of remission or where they stop growing, and then something can trigger it and then they start growing again. So it's difficult to predict. It's difficult to predict. We have patients with keloids of almost all ages, though it's less common in children. And some people believe that, the formation of keloids is linked to certain hormones that occur in puberty because we find that we don't have so many young children having keloids. And most people, if we notice, don't develop keloids from the ear earring hole they have as infants. But that same person may pierce their ear at the age of 17 or 18 and develop a keloid. So what's different between when you were a baby and you had your ear pierced and when you're like an adolescent or adult? So some people believe it's associated with the adolescent sex hormones that occur, androgens, which are not present, in early childhood. But this theory hasn't been completely proven yet. It's like under study or research.
Mm.
But we have people from ages 2, 3 to as high as 80 years having keloids, and some have had them for several years. We have some people have quiet keloids too. After treatment, they don't come back. But we have some people that have very stubborn keloids that just keep growing. But there are things that people can do to aggravate their keloids. One thing I always tell my patients is do not, if you have keloids, do not scrub them, do not scratch them. Every
What's in
touch is
each?
the trigger, yes. So if they itch, there are ways you can control the itching, but the more you scratch your keloids, the more they're going to grow. So if they itch, I always tell people apply a mild steroid cream over them. You can use some hot water compress over them, things that can control the itching. But the minute you start itching, it's a vicious cycle. You itch, you scratch it, it itches more and it keeps growing, So that's one major thing. And then of course, scrubbing and scrubbing, we like scrubbing in Africa. The scrubbing doesn't help, particularly with keloids. If you're scrubbing your keloid, you're just going to be growing it. So a soft washcloth when taking a bath over a keloid that does not induce friction
Hmm.
is probably helpful. And like I said, I'm of the opinion that one of the causes of keloids is excessive scrubbing because it produces micro tears. So if you have a tendency to have keloids, that can be a trigger, for some people.
Thank you. Faisal on WhatsApp, I think you've touched on it, but for it to be further lucid, says, can you get keloid from the barber's shop? I have bumps only when I do clean shaving. So I stopped doing clean shave and I don't barb my hair to skin. Please advise more.
Yes, you can get keloids from a barber shop if you have a tendency to have keloids. I've seen a lot of people, a lot of patients with keloids that have them on the jawline where they shave or at the back of the head. So that is very possible. Usually we advise people to have a clipper that is the clippers tend to leave less bumps than like shaving sticks or shaving blades. And that's because in most clippers nowadays, the blade does not come, they make it in a way that the blade doesn't come in direct contact with the skin. For people who have very sensitive skin, I always say, okay, maybe keep a beard and just trim it so it's not coming, the blade is not coming in direct contact with, the skin, and keep your hair as well. Because every time you have a skin cut or a clean shave, there is a risk of injury, which can lead to bumps. And if you're a keloid former, can lead to keloids. Some people say, oh, their job does not permit them to keep, any form of beard. They're meant to be clean shaven. But if you have that tendency, you can actually get a doctor's report to help you to support that. So that's what I usually say. So, and also shaving in the direction of the hair, not against the direction of the hair, can be useful for shaving, you know.
Thank you. I'm sure the men are grateful for this information. Then Wilson has an interesting question saying, since keloid is caused by excess protein, if I'm right, does it mean we should reduce our intake of protein or maintain a certain regular intake? How often then do we take protein? Prevention, they say, is better than cure, or I just want to prevent it regarding my intake of protein.
Well, unfortunately, there are no studies to show that the protein level there's a relationship with the amount of protein intake and keloid formation. The body is very special and unique. Even if you don't take protein, if you have a tendency to have keloids, your body will find protein in it and produce the keloid. It's
Wow.
not directly linked to what you consume or what you eat,
Mm,
right? It's a code, okay? And that code, will carry out its instructions with your body. If you don't eat protein, it will probably get protein from other parts of your body and use it to create the keloid,
that's a tough
unfortunately.
one.
So will not, eating less protein will not prevent keloids. At least there are no studies to show that, and I don't think that is the way the body works. Okay,
Mm,
so unfortunately, unless you're going to be completely protein deficient, and even then, I'm not sure that would be a there will be any change. So
mm.
please eat healthily. What we advise is a balanced diet or an adequate diet with proteins, with vitamins, with carbohydrates, fats, and fiber. Always eat a balanced diet, adequate diet. Don't starve yourself because of a keloid. How to prevent keloids is to reduce um exposure to injury, like try to be very careful. If you know you're a keloid former, please don't go piercing your ears or piercing your belly button and all that. If you need to have surgery, please inform your doctor that you're a scar former. There are some surgeries that they may not do, or there are certain types of incisions that they will take and suturing that they will take to try and reduce the risk. And usually after the surgery, they would ask you to come for an injection to minimize the risk of the keloid formation.
Mm.
Those are some of the things you can do. Don't over scrub your skin because that can also lead to keloid formation in people who have the tendency to have keloids. These are ways that you can minimize your risk of keloid, but being a genetic tendency, you cannot completely remove the risk of forming keloids, unfortunately.
Well, if you are joining for the first time, we're talking about keloids, the causes, the prevention, as well as the treatment options, although we've not gotten into the treatment options yet. But if you have any question, WhatsApp line is very active. WhatsApp is 0809-444-0981. If you're sending a message for the first time, please include your name and your location. And then we are live on YouTube as well. You can use the live chat option to ask a question or to drop your comments. On WhatsApp, Michael says, for the itch, I use a hot ointment. I call it fighting pain with pain. Afterwards, skip shaving till the skin heals. Does that work?
Well, there is sometimes you can use pain to control itch. So for some conditions where it's itchy, you can actually tap it to reduce the itch. But the hot oil treatment and shaving over it, I'm not sure over time you might end up having some issues.
Okay. All right, now going back to it, let's talk about the treatment option. So how do you even get rid of these things? But before we even talk about the treatment, I just want to clarify. Again, I don't like those things that get associated with genes. The fact that my grandparents had this thing does not mean I have to have it. Unfortunately, some of us do. And it's so annoying. So
Yeah,
aside genetic factors, because I realized, according to some books I saw, being black also predisposes you to keloids. Is that true?
yes. So it's more common in darker skin types, not just black, but it's a lot more common in black and Asian people who are dark skinned. So yes, it is associated with dark skin. Maybe the more melanin we have, the greater the tendency to have this keloid. So
Okay.
yeah, unfortunately, you can't really we can't really change that. Even if we change it on the outside, like some people are trying to do, you can't change your genetic makeup yet. Maybe in the near future, there'll be some genetic modification therapy that we can do to edit out
Yeah.
genes that are, but for now, unfortunately, we're stuck with and the funny thing about genes is they're not always expressed. So you have some people who, even though they have a gene, it's not active. So
Mm.
maybe one of the things we should be researching is how to make certain genes inactive, because that will also be a way to prevent certain conditions, that are genetically linked.
Let's just
I would,
edit the things out.
yeah, yeah, it would be nice to be able to do that, but I'm very sure that those kind of treatments will also come with their negative sides. But
Mm-mm.
the future is very bright with possibilities, medical research. But for now, how do we treat keloids?
Yes.
There are different modalities of treatment. One of the common modalities is injections, intralesional steroid injection. So we inject steroid directly into the keloid and it kind of shrinks it over time. There's also the injection of a liquid we call 5-fluorouracil, which is an anti-cancer drug, but it also kills the fibroblasts and the fibrous tissue that the keloid forms. So that's another way. Then cryotherapy is used. Cryotherapy is using very, very low temperature, like minus 80 degrees centigrade, liquid nitrogen, and it destroys the keloid using by freezing it basically. So freezing causes something we call cryonecrosis, where the freezing destroys the cells, and so they begin to, crumble off or fall off. So cryotherapy is also used to treat keloids.
Mm.
And then there's radiotherapy as well. Radiotherapy is also used in the treatment of cancer. And in some cases, we use it to treat keloids. Remember, I said the keloid cells kind of behave like cancer cells sometimes. So a lot of the treatment is kind of like, but not a systemic cancer treatment. It's directed or targeted to the keloid itself. So you can use radiotherapy, UV, not UV radiation, gamma radiation, I believe, to target the keloid and destroy it. There are also a few new therapies. Some people are using injection of vitamin D into keloids, which can help to shrink it. Silicone in the early stages, silicone sheets and silicone gel for the early stages of keloids can prevent further formation or proliferation of the keloid. So these are some of the things that we use to treat it. Because it's a chronic condition, it's not a one-off treatment. So, for instance, the injections usually have to be monthly or every 2 weeks for up to 3 to 4 months, and sometimes up to 6 months before the keloid is totally flat. And it's the same with cryotherapy. You may need 3 to 4 sessions, sometimes 2 sessions to get rid of the keloid. So cutting the keloid is an option, but if you cut the keloid, like surgically remove it without any of the other options I mentioned, it's going to come back, and usually it grows back more aggressively and
Oh,
larger than it was before. So surgical management, some people say, oh, I'm just going to cut off this keloid. It's very, very wrong to do so, because the same process is just going to happen again. And most people who cut keloids off without any additional therapies like the ones I mentioned, the intralesional steroids, the intralesional 5-FU, or radiotherapy, they end up with a larger keloid than the one they cut off in the first place. So please don't allow anybody cut off your keloid, because it's going to come back with more force and more vengeance. But sometimes we do cut off part of the keloid as part of the treatment and then continue with some of the other treatment modalities. It's said that it's better to treat keloids with more than one of these modalities, so you can combine surgery and the steroid, or cryotherapy and the steroid, or radiotherapy and surgery, and you have a better outcome. The unfortunate part about keloids is that even after treatment, they can reoccur, and there's up to a 40% risk of recurrence of keloids. In some cases, even more than 40%. So it's very annoying. And keloids fight back. I always tell people, when you fight keloids, they fight back. But we are looking out for more successful therapies for the management of keloids, and a lot of research is still going on, for this, because the current therapies, like I mentioned, the rate of recurrence is quite high. And so people are not happy that after going through all those injections and the keloid goes away, after a few years, it starts to come back. But
that's
that's where we are right now.
that's annoying. Very
Very
annoying. You
annoying.
spend time, pain, and money. It's just
Yes,
annoying.
yes.
That's
It is,
stubborn
it
life.
is, it is. But there are some people, the keloids have managed when, they're flattened out and the person is extra careful with friction, with abrasive touch, even some kind of clothing you want to avoid. Very all these lace, like all these our mummies that wear these very abrasive lace that's quite uncomfortable. You should ideally not wear those kind of clothes if you have, a keloid, so that they don't scratch the area and all that. So being careful about clothing, about washing, bathing, and making sure that you don't add any friction to it. And for a lot of people, the keloid stays quiet for a long time.
Mm. Okay. I'm sure in another episode or another time, we're going to have a whole discussion about having your bath with sponge, because it's something Nigerians do not want to hear. They must
Yeah,
scrub and scrub and scrub, just the way you
yeah,
have
there's
people
no need.
scrubbing the teeth.
Yes, actually, the skin, there's no need to over scrub the skin. A soft washcloth is sufficient. But we've gotten so used to, we've been programmed. It's like more of culturally acceptable than necessary, really. So it's like a culture now, and getting people to understand that, you don't really need to do that. And quite a number of people shouldn't, because of the kind of skin they have. It's very difficult, but we'll keep trying to educate people, and, hopefully some people will accept.
I can imagine somebody rolling their eyes and saying, "Are you saying I shouldn't use a sponge? I won't feel clean." Well,
Oh,
it's
yes. when I did a post about that, it went viral and I got a lot of people saying you must be you're not you're not you must not be a professional or you must be a dirty person or all kinds of things. But also some people actually also gave their own they testify that yeah, when I stopped using a sponge, I stopped itching, my skin was more soft and supple. Not saying don't use anything at all, but use something soft and gentle, that won't cause any abrasion on your skin. That's, you know, what we advise. But we'll keep
Thank
trying.
you. Yes, we'll keep educating and trying. Now, on a final
Yeah.
note, Wilson takes us back and said, does barbing your hair till the scar clear everything? Is it right to apply something on your head to stop it from growing? And is it right?
To stop what?
When you barb your hair, or when you cut your hair rather, do you have to apply some preventive ointment or oil to prevent it? I think he just wants to be
To
crystal clear.
prevent the bumps, right?
Yes.
Well, some people, sometimes we do recommend that for some people. There are some anti-inflammatory creams that you can apply if you have a tendency to have bumps. So after a shave, you can apply that onto the area. Yeah, that could be helpful.
Okay.
Sometimes we do an over-the-counter anti-inflammatory cream called hydrocortisone. It's a mild steroid, so we don't like people to use steroids excessively. But for people who have a lot of inflammation or bumps, mild steroid hydrocortisone may be helpful to prevent, bump formation. But we do not want people to abuse other kind of steroids. A lot of the steroids that are sold in the market are not advisable for use without a prescription. But the true over-the-counter steroids like hydrocortisone, which can be used even in babies, can be helpful. But generally, if you do the shaving properly, you may not need to use that.
Okay. Thank you. We've come to the end of this chat. And if you are just joining us, we've been talking about keloids, the causes, the risk factors, the prevention, and most importantly, the treatment options that are available for them. And you can find this video on YouTube. That's on our official YouTube page. That is Smooth 91 FM Lagos. That's the YouTube channel you're searching for. Smooth 91 FM Lagos. And it's been a good time with you, Dr. Folakemi. Always a good time. I'm looking forward to having a chat with you about babies that are being bleached these days, or children
Oh,
that
yes.
it's terrible.
It's really sad, but we need to have more advocacy. I just want to add that if people have keloids, the best thing they should do is see a dermatologist early. Don't wait until it's massive. Go to a skin clinic where you have a dermatologist, preferably in a teaching hospital, where the expertise is there for the treatment. Don't just try and treat it on your own because a lot of people come late, and by that time the keloid is already huge, and it's best treated in the early stages where you need very minimal treatment and the chances of it recurring are less. So that's just, I forgot to add that treatment should be as quickly as possible. Don't wait. See a dermatologist, see a plastic surgeon, preferably in a teaching hospital.
Thank you very much. Now, for people to catch up with you and the kind of content you create, your channels.
Yeah, I'm Fola Derma Doc on Instagram, on TikTok, at Fola Derma Doc altogether. And there are lots of videos on various skin conditions, particularly us dark skin or African people, that you can learn from. I'm not very good at DMs, please. There are just too many, but you can learn quite a lot from just watching some of the videos, and that's why we're there to improve skin health, advocacy, education,
Yeah.
and awareness from, the experts, from the right sources.
Thank you. I look forward to another chat with you, and always a pleasure to have you as my guest, either virtually or physically. Thank you.
Thank you so much. Thanks for all you do. Take care.
Thank you. Bye.
Bye.
All right, Lagos, Nigeria, and world. Thank you for being a part of the chat. It's been good. And thank you for your questions, your comments, and those things that you just wanted to understand about keloids. Hopefully, it will help you make better decisions, maybe in terms of the prevention or in terms of the treatment, because it's important. On the other side, which is in a 3 minutes time, we will be with the children on the show called Curious Minds, where they will be spelling, but not just spelling. They need to guess the meaning of the word before they spell it. And I always get to have a great time with them. You're listening to Smooth 98.1, and my name is Oluwaseun Olusegun. We start with figuring out what does health look like. Thank you for joining my live stream. See ya next week.
Healthy mind,
bye.
Healthy body, healthy life. Soul food on Smooth 98.1.
Bye.